Hi everyone, this is Counseling 4000, Chapter 21, Preparing for a Service Planning Conference or a Disposition Planning Meeting. So completed, assessment on the client, a tentative plan with that person has now been created, meeting for a more specific plan to be made for the person's care or services. It's also known as a service planning meeting, a disposition planning meeting, a care planning meeting, a case planning meeting. So it could be known as any of those things at your place of work. Some agencies you work for will require you to do this informally, so there is no meeting at all. You would just do it yourself. For children, children's panel, which consists of child psychologists, child psychiatrists, social worker, pediatrician, and then others. Together, they decide what combination of services would best suit people in their current situation based on the assessments and gives a diagnosis if needed. So in case there's insurance purposes, you would do it then. If a client has a substance abuse problem and a mental health problem, agencies from both are invited into the meeting as well to talk about that. So it might be the Department of Rehab, Regional Center, something like that. What you will need to bring to the meeting. Number one is the tentative service plan that you had created with your client. Number two is a human service directory, list of service providers if you are not familiar with the client's community already. And of course, three is the DSM handbook, which is the one of the diagnosis handbook, okay? Goals for the meeting. Number one goal is diagnosis. So remember the DSM book that we were talking about? This is when we officially decide exactly what the diagnosis is. And why is that important? Again, that comes with insurance, right? Because you need to get paid. Everyone who is working to help this person also needs to get paid as well. So again, that's the first thing that you need to do so that people understand why they have to pay for this person's well-being. Goal two is the level of case management. So do we need administrative case management, resource coordination, intensive case management, or targeted case management? We'll talk a little bit about that in the future. Goal three is services, the strengths and weaknesses of the person. So we want to know, what areas are they really good at so that we can try to create goals for them that are in the similar strengths so that they're motivated to achieve these goals. What the person said she wants or expects, what services this person could use well or fit into very well, what the major problems or presenting problems were, goals you have for the person and the person's own stated goals. So what are some of the things that you would like to see this client achieve, but then also what does the client say that they also wanted to achieve as well? And any other pertinent circumstance about the person that you feel is relevant. Developing in this meeting a plan for series and also treatment if needed as well. So again, you have to also plan on how often are you going to be talking, meeting with people, and evaluating what is going on. Benefits of conference planning is to have more than one person take a look at this case because maybe there are people who have very specific goals and viewpoints, experience that they can contribute that will actually resolve the problem even better or quicker or more successfully than without, Obviously, one person is great, and especially if you are experienced and you are motivated and trained and all that stuff, but, other people will come in with different perspectives and you're like, oh, I never thought about approaching this problem this other way, and that actually might be better. So again, always it's wonderful to have other people contribute their ideas, their suggestions, and then you evaluate what is good and what is helpful, and then you proceed from there, hopefully. Collaboration, it is important to ask questions in a collaborative and respectful manner. Again, you don't want to say, I think what you're doing is wrong. Instead, you might want to say, have you ever considered from this point of view? Or, I worked with this client similar to this, and this is how we approached it. I don't know if that's something that you might want to consider. And so forth and so on. And that's really respectful and considerate. You are saying that I respect you as an intellectual person with resources and everything, but I also wanted to contribute some stuff as well. Okay. Do not grill the people presenting the cases because that doesn't really help anyone, really. Okay. So you have the conversation, but have it in a respectful, assertive way, not aggressive. Aggressive is just telling people what to do without caring if they feel good or bad about it. Assertive means, hey, I'm going to let you know what my viewpoint is, but I really also appreciate where you're coming from as well, and I want to work together. That assertiveness is respecting other people's feelings when you tell them, your own ideas as well. Preparing to present your case, like a bio for your client. Number one is, why the person came to the agency. What are the presenting problems? So that's something that you want to prepare and write out. 2, how the client presented in the assessment interview. So again, reading about their body language and all that other stuff. Did they shower? How was their facial expressions and stuff like that. 3, what the individual indicated are his goals and expectations. And 4, additional relevant information that could have or would have bearing on the disposition of this case. So any additional things that might be something that we need to pay attention to as well during this time period. Maybe their partner is very abusive and we need to be sensitive of that, right? That's something that they would need to know. And then 5, your impressions and your recommendations. There's a sample presentation on page 384, 385 in your textbook. Follow up to a meeting. After the treatment planning conference, you will write up a formal service plan for your client using the treatment or goal plan form. Once you are done with this, meet with the person and discuss the plan, and then of course now make the referral so that they go to those provider agencies as we had talked about in the previous chapters.